took out in the Tribune, Sun-Times, Green Bay Press Gazette, and Milwaukee Journal Sentinel in these Sunday's editions. Mary Beth can talk a little bit about today about the reasons behind that, what's going on, and why we thought this was a good idea. A few of you submitted questions in advance, and we'll try and get those questions answered. And if you have some others, you can put them in the chat, and we'll try and get those answered as well. We're going to try and keep this pretty brief to respect Mary Beth's time. So for starters, Mary Beth, maybe you could give us a few opening comments on why the ad was taken out, what the kind of the underlying reasons for it.
Sure. Good afternoon, everyone. Thanks for being here today, and hope you all had a great holiday. So the hospitals across the country are taking out ads. I think you'll see them in many other states as well as ours, as well as in Wisconsin and Illinois. And the reason is that we're just seeing, we're just seeing a huge surge in cases of COVID. And we can't stop this by ourselves. We really need the public support in doing a number of things, most importantly, to get vaccinated. Certainly, if you're 6 months past your Moderna and Pfizer, to get boosted, and to follow the safety measures that we've outlined, such as masking in indoor spaces and keeping social distance. This is really critical if we're going to get this latest surge and indeed the entire pandemic under control. I'd also add that in the midst of this surge, across the country, we're facing a national shortage of healthcare workers. Nurses, certainly, but not just nurses. And this is compounding some of the issues we're facing in the hospital as we see many more people coming in who are positive for COVID, many other people coming in who may have delayed seeking healthcare during the last almost 2 years now, and then with reduced numbers of staff to provide care. We're holding our own, but it is definitely, we're starting to feel stretched. And so that's why we and other healthcare systems are out there asking for the public's help in getting this pandemic under control.
Thank you, Mary Beth. And the main question we got from the reporters here was talking about what's going on in our hospitals, which I addressed, but maybe you could just to those questions speak to you mentioned holding our own. What are we doing? What kinds of things can we do to be flexible to try to
But even to put things in context, I mean, we do have our EDs, our emergency departments are seeing many more patients. And so that results in people waiting to be admitted, which, that certainly is not where we want to be. And our ICU beds are often filled. And so thankfully, as a large system, we're able to make some moves as needed. We're able to shift staff. We're able to pull in different individuals to help. But it still is very difficult as we go through this. Our care providers have been in this, as I said, for almost 2 years, and there's a fatigue and an emotional drain that is occurring as well. So we're very attentive to their health and well-being so that they will be here when the public needs healthcare and is seeking healthcare.
Great, thank you. And the other question we got in advance was a question about there are a lot of holiday gatherings. People are gathering where maybe there's an expectation there's going to be a further spike in cases going forward here. Let's say you get tested, you get a positive test. What should you do about that? What should your first step be? And what should you do going forward?
Yeah, isolate from your family members if possible. We know not everyone has the space and ability to do that, but stay in a separate room. If you have the opportunity to be able to use a separate bathroom, use it. If not, clean very thoroughly. If you are around other members of your family, mask, stay hydrated, and monitor your symptoms. And if they worsen, call your care provider or seek help. So for example, if someone develops increasing shortness of breath or chest pain, you really do need to be seen then. Otherwise, if symptoms are mild, rest up and hydrate and isolate.
Thank you very much for that. Are there any other questions from the group here? I'm sorry, I'm having a technical issue here, but are there any other questions from the group? Well, if not, do you have any final? Oh, go ahead.
Sorry, I was just running into the office. This is Bruce at Channel 4 here in Milwaukee.
Hi,
Question for Mary Beth. Hi, thanks for taking the time today.
Sure.
Is there the potential, or is there a certain point at which you may have to turn away patients, whether that's ICU or otherwise?
Yeah, at this point, I would say we have not had to do that, but we're looking at a very difficult winter if influenza increases and if this surge continues. So I don't see us, certainly at this point that has not been the case. But we'll partner with other healthcare systems and the health departments as this unfolds during the next few months.
Thank you.
One thing I would add is that in our hospitals, over 90% of the people who are hospitalized have not been either are unvaccinated, about 75%. And then there's a larger proportion who are maybe received one shot or who are due for their booster and haven't gotten it. Only about 8% are fully vaccinated, and they usually have an underlying condition or immunocompromised. So that's the main message. That's what's going to help us, is that if you are vaccinated, the likelihood of needing to be hospitalized is dramatically reduced. That's the message I'd like to get out there.
Thanks so much, Mary Beth, and to everybody on the line. We can get you those specific numbers if you put them out a few weeks ago. So with that, I think we'll wrap up. I really appreciate Chief Nursing Officer Mary Beth Kingston for being on the line today, and for everybody joining us. Get vaccinated, get boosted, and we'll see you around. Thanks.
Thank you all.